Hello and welcome. Today I'll be covering anterior hip precautions. Precautions are also defined as movements you want to avoid. They are: avoid external rotation, turning your leg outwards, avoid crossing your leg or hip adduction, or avoid bringing your leg behind you, hip extension. These three movements are great to memorize. However, functionally you have to be aware of what you're doing and make sure you're avoiding these positions. And I'll describe as we get in and out of bed, how we walk, and how we get in and out of a chair, and also getting dressed. When getting out of bed, you have to be very careful. If your surgical leg is your right side, if you're exiting towards your right, you do not want to turn the leg outwards, as that is one of your restrictions. And also, if you bring the leg off, you don't want to drop it off the bed first, as that leads to hip extension, two of your restrictions. So we typically say, if you can come up on your elbows and bring the legs off together and eventually push yourself on up, and to avoid bringing the leg off and externally rotating it. Now with walking, we'd ask you to walk straight ahead. When you turn, typically we say to turn away from the affected side, your surgical side. There will be instances where you have to turn towards your surgical side. Just avoid turning the foot out first if you have to turn towards your surgical side. Try to turn the walker, then the foot, turn the walker, and then the foot to limit that movement. Also at times, you're standing at the sink doing your ADLs, cleaning your face, brushing your teeth. Avoid, if you have to, stepping away with your surgical leg planted, as in if my right leg had the surgery, you want to avoid turning away from it, as in this leg is now turned out. Even though you didn't physically turn the leg out, with it being planted and you turning away from it, it led to that motion, so you have to be careful to avoid that. Also, if something falls on the ground, you're not going to be kicking the surgical leg behind you to get down on one knee to grab it, as that is too far of a hip extension. When getting dressed, one of your restrictions, you're not able to cross your leg, and sometimes you don't want to bend too far forward if it's feeling strained in your hip. So you want to use adaptive equipment to help yourself dress, getting your socks on, your shorts or underwear.